Today we will be exploring the impact of acute high-intensity interval exercise, also known as HIIT, on biomarkers of cardiovascular health in type 2 diabetes. Regular exercise preserves vascular function and lowers cardiovascular risk factors, yet fewer than 50% of U.S. adults meet current exercise recommendations. The purpose behind the study was to observe the effects of HIIT training on biomarkers of cardiovascular function compared to normal traditional exercise. Study 1 included 16 subjects that were split into two groups, 8 participants with type 2 diabetes and 8 non-diabetic participants in the control group. Study 2 included 10 men diagnosed with type 2 diabetes that were accustomed to HIIT training. In Study 1, diabetic and non-diabetic patients performed 7 by 1 minute intervals at 85% peak power, followed by a recovery period. In Study 2, 10 men with type 2 diabetes did 10 by 1 minute intervals at intensity of 90% peak power on a cycle ergometer, followed by another recovery period. Circulating molecules such as thrombomodulin and troponin T were also measured for both studies. Statistical data showed that there were no major systolic or diastolic blood pressure changes within the groups. Additionally, mean arterial blood pressure was not significantly different between the two groups. Lastly, there were no significant changes seen with the biomarkers, troponin and thrombomodulin. Ultimately, HIIT training does not make a large, lasting impact on the cardiovascular markers related to type 2 diabetes. Additionally, reduced blood pressure in the control group may show positive benefits in healthy adults from HIIT training. However, more research is needed to examine the time course of vascular responses to HIIT training and to determine their potential relationship to cardiovascular benefits of HIIT interventions in patients with type 2 diabetes.